We all want to grow old healthy. Who doesn't want to be this active when you're 70, 80 or 90 years old? In the Netherlands, we have a rapidly aging population. We have anticipated for this, and to lower the pressure on doctors and on hospitals, we have educated nurses to detect early symptoms and to give treatment at home. By doing this, we reduce the healthcare costs for the hospitals. This works perfectly well, for instance, for dementia. When treatment starts early, the cost of treating dementia and the symptoms later on will be lower. The Netherlands and China have a lot in common. We both have a rapidly aging population, and we would really like to intensify the cooperation on healthcare to see where we can improve both our healthcare systems.
Under the strategic directions defined by the Chinese government, I think 90% of the Chinese elderly will be taken care at home. To support such increasing demands driven by aging populations in China, I think we will need a solution that delivers quality of care according to the professional standards in a cost-efficient way. Netherlands has been recognized as one of the most innovative countries in elderly care around the world. So basically, Buurtzorg is one of the leading organizations in community care in Netherlands. I believe Buurtzorg contributes significantly toward the Chinese elderly society.
Home care and home care nurses are the cornerstone of Dutch elderly care. Dutch elderly care policy is aimed at making sure that elderly can live independently at home.
So Buurtzorg has a vision to support and help elderly to live at home as independent as they can. With that vision, Buurtzorg nurses are able to take preventive actions to reduce medical costs for families and governments. At the same time, we reduce the service hours along when the elderly regain the independence of living.
In the Netherlands, we have several certification levels of nurses. First of all, we have nurses and caregivers who receive vocational education and training. Then we have bachelor nurses and master nurses. They receive higher education. Community nurses always are nurses who have received higher education, so they are bachelor nurses.
Buurtzorg nurses have a tradition of working together with the family members in a very close way in one team. So by sharing knowledges and involve them in the care activities, that we support family members to take care of the one they love in a more effective way and reduce the frequency of hospital visits.
The quality of home care nurses needs to be high. They must pay attention to aspects of care, prevention, assistance. They need to have knowledge about technologies, social relations, and they also have an eye for new types of collaboration. This is all very important. So integrated care is crucial to optimize home care for the bigger and larger and diverse group of elderly that is upcoming.
I think we can work together starting from establishing joint teams, share experience, then work on pilot projects to pursue the long-term goals such as providing quality care at lower cost for Chinese elderly community.
If we exchange professionals and students between our cities, we can cross over our knowledge, but also our ideas about innovations that we test and implement in practice. To move further, it is important to share knowledge and experiences across disciplines and across country borders.
I see great opportunities to work together on solutions for a better healthcare system. The Consulate General of the Netherlands in Shanghai is here to assist you. Let's work together for a better future.